Hi, my name is Daniel Lewis, and this is going to be the demonstration of the insulin injection, the sub-Q insulin injection. All right, so first thing, it would be perform hand hygiene, and I'm going to verbalize the 6 rights of medication administration, which is right patient, right medication, right dose, right route, right time, and right documentation. First thing I'm going to do is check my orders. So this order is for 20 units sub-Q of NPH insulin, and they have a blood glucose of 245, so that would be 10 units of regular insulin. So first thing I'm going to do is check the vial for any cracks and the expiration date. So this is the NPH, and the expiration date is, or that's the regular, and so the expiration date's good. The NPH is also good. So I'm going to mix the NPH insulin by rolling it between my hands. Alright, now I'm going to use the alcohol to clean the top of the NPH insulin. And then another alcohol to clean the regular insulin. And I'm going to let those dry. While I do that, I'm going to open up my insulin syringe. Alright, so I'm going to pull back, what is it? Orders for 20 units of NPH. So I'm going to pull back 20 units of air to inject into the NPH. And then I'm going to pull back 10 units of air to inject into the regular insulin. Then after I do that, I'm going to go ahead and withdraw the 10 units of regular insulin. Alright, and then I'm going to pull back the remaining 20 units for a total of 30 units of insulin. Alright, now that I have the insulin, I'm going to use the one-handed scoop technique to recap the needle. And then I'm going to have another nurse double check this. So I'm going to use my wife. So can you check that?
30 minutes.
Okay, so it was verified that that is 30 units. So now that I'm done with that, I'm going to go to the patient's room. So I'll knock on the door, introduce myself. Hi, I'm Daniel. I'm going to be your student nurse today. First thing I do when I go into the room is I'm going to perform hand hygiene and ask the patient to identify themselves by saying their full name and date of birth. And at this point, after they identify themselves and I make sure that I have the correct patient, I go in, I'm going to make sure they're, in a sitting position or something like that. If they're laying down, I'll have, raise the back of the bed up. Once I get in there, I will choose the appropriate site. In this case, I'm going to go into the right upper quadrant of their stomach. And so the first thing I'm going to do is put on gloves. and then I will grab my alcohol swab, and with my site I will start in a circular motion and moving outwards, clean the site, and then I will allow the site to dry. Alright, so now that that's dry, I'm going to uncap the needle. And I have the site here, so I'm going to take the site and kind of pinch up the skin. And if it's an obese patient, I'll go in at a 90-degree angle. If it's a skinnier patient, I'll go in at about a 45. So I'm going to say I'm going in at a 45 here. So I will inject it, and then I will slowly administer the medication. Once the medication is administered, I'll leave it there for a second, and then I will pull the needle out in a quick motion. And then I'm going to go ahead and recap the needle with one-handed, and then I will dispose of the needle in a sharps container, and then I will grab a cotton ball and blot up any blood that is remaining after the injection, and then I will go to the computer and document that I did administer the 30 units of insulin to this patient.